nursing.
midwife. Who is a midwife? Because I did the labor.
Oh.
You practice midwife for example. Yes. One midwife, one nurse. Yeah. Yeah. And tologist, and the tologist, and you two. Two tologists, and senior and younger. It's okay. You give birth. Midwife take the baby out. Yeah. You know how to give birth for mother? Yeah. And you weigh the baby out. You wear saturation. Yes. You have to clean baby and give away. You keep this and you keep the CPAP and you take the saturation. You and you have to check the heart rate and check the check movement. Yes, that's okay. And you will continue to arrive for baby and cover by plastic. We have the three. One for right, one plastic cover, and one dry cover. And it's okay. We have three. Yes. It's okay.
Yes.
You understand all? Yes. Okay. Yes. Now we have action. Yeah. High five. Yes. 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 Good. Let's go. Yeah. Now I have to give a mother. No. You sit down here. Now I give a consent. I give a consent for mother. Hi, mom. What's your name?
Rina, ma'am.
Rina.
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 Rina, ma'am. Rina.
Ah, hi, Rina, mom. It's okay. Rina.
Yes, ma'am.
It's a book. Rina. It's a Rina. Yes. How many weeks you have, baby?
Weeks. 37.
No. Less.
Okay.
Very little.
Very
30 or 20?
28 weeks.
28 weeks. Yes. You worried? You worried?
Are you worried?
Are you worried about the 28 weeks when the go baby go out?
Any worries baby 28 weeks?
Yes, ma'am.
What worries you have, ma'am?
Baby's very low birth weight.
Yeah.
And during the pregnancy time, so many complicated in baby.
Yes.
So I feel very bad.
Yeah. Now I will help you.
Okay.
We are the team, strong team.
Okay.
Neonatologist, both of us, neonatologist, and midwife will give birth for you, and nurse will have the neonatologist team. Yes. And I have the two choices for you. First choice, after birth, I resuscitation, I cut the cordon, I take the baby to the NICU, put the baby in the incubator, you stay in the postpartum. And second choice, I keep the baby skin to skin contact with you, and follow up you, I will beside you until the baby is stable. Which one will choose?
Skin to skin.
Oh yeah, high five. Yes. But when the baby is born, you cannot look at the baby. Oh, where my son? You can look here. You look here to observe the baby when the baby is stable. You keep it. Yes. And you look at me wash hand because it is very important for prevent from infection for the baby when you touch baby. Now you take the assembly wick. You look at me first. Take the assembly wick. Yes. 1, 2, 3, 4, 5. Look at me. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, look my hand. Not look at my face. Look my hand. 1, 2, 3, 4, 5. Look my hand, please. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. It's okay. Okay. Yeah. Follow me. Give it over. Check liquids. Yes. Yeah. You make the with your hand. Two hand. Yes. Follow me. You practice for me. Yes. 1, 2, 3. No. Yes. 1, 2, 3, 4, 5. Yes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Stronger. For all the up germ out. You understand? Yes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. No. Yes. Like you ride motor. Yeah. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You remember? No. Maybe day by day you will remember in your mind. You can do. If you don't remember, you ask the staff. They will show you again. Yes. Now, I check your abdomen. Maybe nurse, midwife, check the baby here. Go up. You yes. Now your baby should go. Now you down up the table. Remember? Yes.
I think no need. I think no need. I think no need.
You check? Yeah, for her. Yeah.